In autism, there's a variety of reasons why kids just don't fall asleep very quickly. And it can range from just being overstimulated or over-aroused to having a medical issue, or having challenges understanding what their parents are asking about in terms of getting them to sleep. So all of those are addressable, but yes, 1 to 2 hours of sleep is unfortunately pretty common in autism. I like to divide it into three different categories. It really helps me explain it to parents. So one category is all the medical issues that kids with autism or adults with autism could have, ranging from GI issues to seizures to medical conditions like anything from eczema to even things like sleep apnea. Then there's the behavioral category, and this could be everything that kids without autism are challenged by when it turns into, comes to sleep. So this could be your being on screens, not getting enough exercise, getting too much caffeine. All of those things can interfere with sleep. The third category is issues intrinsic to autism. So this might be genetic issues or problems with melatonin processing, or I mentioned the over-arousal a few moments ago. And these, again, are addressable and treatable, but they may be a little bit more unique to having autism. I think there are some simple things and then some more complex things. In terms of the simple things, we always start with sleep hygiene. Are the screens off at least 30 minutes, if not an hour before bedtime? Is the child engaged in exercise during the day? Is there caffeine being used? So we can try to limit that. Sometimes it's more complicated than that, like the medications or the medical conditions. And that's where working with the child's pediatrician, or in the case of adults, in the case of the primary care provider, to try to really understand what medical conditions might be at play and how can we tweak the medicines to minimize problems with sleep. What I found over the years is there are a lot of different ways to treat sleep. And when we treat sleep and we improve sleep, particularly in this population, we see a marked improvement in how kids are functioning during the day. It makes just a huge difference. My best sleep tip is really prepare yourself for sleep. So for any of us, parents as well as kids, what we want to do is wind down before bed. So this is turning off those screens, maybe doing something relaxing like a warm bath or reading a book, anything that really gets your brain to turn off and takes you away from the stress of the day and get you ready for evening. So that would be my number one sleep tip for anyone. Melatonin does help with sleep. It is safe. And for whatever reason, we found it to be more helpful in this population of autism than in any other. And I don't know why. It may be problems with melatonin processing. It might be more over arousal in this population. But what melatonin does is we make our own natural melatonin, but oftentimes we need supplemental melatonin to help boost that. And it may be just acting as a sleep promoting aid, but we also know that it helps mitigate hyperarousal, and it also decreases anxiety. So it has a lot of different roles. As I mentioned, it is very effective in promoting sleep. And we have recently published work showing that it appears to be pretty safe, even with 2 years of use. We did a study with a pharmaceutical company, and we found that it remained safe and efficacious even after 2 years of use. And also, it didn't interfere with the development of puberty, which if you go online is a concern of a lot of people, because when we go through puberty, our melatonin levels drop. So the concern was, if you give supplemental melatonin, could you interfere with puberty? And we showed that puberty progressed as it normally should in this cohort of kids who were enrolled in the study of melatonin over 2 years. The most important thing is to talk to your doctor or your child's doctor before even before taking anything over the counter, even melatonin. I would recommend talking to them because there can be drug interactions with other medicines that they're on. Where I think it's a great opportunity to improve sleep. We don't have great medicines for helping behavioral problems in autism, but if you can help sleep, if a child could be sleeping better, it makes all the difference in terms of their behavior. So then you've not only improved their sleep, you've improved their behavior as well. You've also improved family functioning and family quality of life. Because if a child is waking up at 2 in the morning, it's going to take a toll on the families, and they're not going to be able to fully advocate for their child the next day. So we really want to focus in on improving sleep because it's a great opportunity to improve behavior.